Hey guys, it's Dr. Oliver. This is just a quick recorded lecture on tobacco cessation. If you haven't taken the APEA quiz yet, you'll notice there might be some questions on this. So that's why Lindsay and I wanted to make sure that we just had a little lesson on this. You will have a little bit more information given to you in the geriatric wellness section. So make sure when you get to that section, it should be a review. There'll also be some other new tidbits of information, but most of it should be a review. So this slide just gives you some general statistics about tobacco use. As you know, there's been certain laws that have been put in place to kind of discourage people from smoking. However, there's quite a few people that are still smoking. So 9.7 million people aged greater than 18 years of age smoke about 20 or more cigarettes daily. There are approximately about 2.4 million new smokers annually in the US. What that tells me right there is that obviously our patients need some more patient education, and this more than likely will fall on you as their primary care provider. So as you read through a lot of these statistics, just keep in mind a lot of the things that you need to be asking your patients and what they need to be educated on. This next slide, as we all know, there's risk factors associated for tobacco use, and then there's also associated conditions that tobacco can cause from people that are using it. So risk factors, so these are people that, if they have any of these risk factors, then we definitely need to be screening them for tobacco use. So if there's the presence of a smoker in the household already, that definitely adds to the temptation of them smoking as well. It also makes it easier for them to access cigarettes, or say you have someone that works in retail, and say they're working at Kroger's or Meijer or somewhere like that where they have access to cigarettes. That would also be a risk factor. So comorbid stress and psychiatric disorders. If you haven't worked with mental health patients before, one thing that I quickly learned when I started working with mental health patients was that probably 99% of them smoke. And that is just one of their coping mechanisms for when they're stressed or when their psychiatric condition just gets out of control. It's one way that they can cope, and it gives them something that they can feel in control with. So just keep that in mind. People that tend to have a low self-esteem or self-worth, they are also people that you will find smoking, because a lot of the times, especially if you think about teenagers, of course, it's something that they're really not supposed to have. They know that it can be harmful from what they have heard. So people are just wanting to look cool and fit in. So keep that in mind if you're seeing teenagers. Poor academic performance, and then boys, high levels of aggression. Girls, they might have a preoccupation with weight or their body image. So what happens then when people do smoke? And this isn't just having a cigarette, a couple of times and then stopping, but these are people that are, your half a pack a day smokers, a pack a day smokers. This is what it can cause, and this is something that you need to kind of make a mental note of so that you can educate your patients on this. But we're looking at coronary artery disease, cerebrovascular disease, peripheral vascular disease, AAAs, COPD, many cancers. Tobacco is a risk factor. And so that's something important for people to know, especially if they also have a strong family history of certain cancers. And then there's pneumonia, osteoporosis. They can have a lot of issues with their teeth, with their gums, with their mouth, just in general. A lot of people don't realize this, especially if they're chewing the tobacco. And then, of course, depression and anxiety. This next slide is just supposed to bring up some pregnancy and pediatric considerations. So for pregnancy considerations, women who smoke or are exposed to secondhand smoke during pregnancy have increased risks of miscarriage, placenta previa, placenta abruption, premature rupture of the membranes, preterm delivery, low birth weight in the infant, and then stillbirths. A lot of pregnant women, especially if they come in they're younger and they're in their teenage years, they won't know this. They may have heard it, but to hear it from their provider that's taking care of them, and not just once, but at multiple visits, you can possibly make a small difference by maybe at least getting them to decrease how much they're using. So just keep that in mind. And then pediatric considerations. So secondhand smoke, we have found over the years that this can cause a lot of damage to people that are around smokers. So it increases the risk for sudden infant death syndrome, acute upper respiratory and lower respiratory tract infections. They can have more severe exacerbations of asthma. So these are for little kids or even older kids as well. If they have an asthma condition, it can definitely cause them to be hospitalized more, maybe have to visit the doctor more. They may have to be on more medications to control their asthma. And then otitis media, and then a lot of the times these kids are more likely, these kids that get otitis media and their parents smoke, they are more likely to have to get the tubes placed as well. And then something also to tell mothers, a lot of women, they will quit for during the time when they're pregnant, and then as soon as the baby is born, they'll start picking up smoking again. But it's one thing that is important to educate them on is that nicotine does pass through breast milk. So it really, we're lacking a lot of research as far as what this causes for the infant, but they have found in some remote research that it does affect their growth and development. So that's just something that they need to know, and then that way they can make a good educated decision. Lastly, one of the topics that you're probably all wondering about is how do we get these people to stop smoking? So if you downloaded the PowerPoint and you look in my notes section that I left for you, there's different methods to quitting smoking. And I did put in, again, I know I've said this on other PowerPoints, I like numbers, I like statistics, so it helps give me a visual in my mind. So I did add these. So for self-help, for people that just kind of quit cold turkey, they have about a 9 to 12% chance of actually quitting. People that just go to counseling, they have a quit rate of about 13 to 17%. Nicotine replacement, and this can include the gum, the patches, anything like that, that's about 19 to 26%. The Zyban quit rate is about 24%. Chantix is about 33%. Medication combinations, that is a quit rate of about 26 to 36%. And then if you add counseling to that, it increases it to about, I typed that in wrong. I'll have to fix that here before I send it to you guys. It increases it to about 42%. So really, if you take anything from this slide, you're going to have to use multiple methods. No one method typically has a good rate of working. So we need to find what works for patients. We need to find out why they're smoking. A lot of people smoke because they can't cope or they don't know how to cope. And so those are people that would be appropriate for counseling because they can go to counseling and learn ways to deal with their stress or their anxiety or their depression. So that's important. If you have a patient that comes in and you know that they have psychiatric conditions, then we need to make sure that those are adequately treated so that we can start working on the tobacco cessation. If you have someone that maybe just isn't educated, then that also plays into it as well. So we need to counsel them on the harms of tobacco. What does that look like years down the road if they've continued to smoke like they are? How does that affect their body? So just keep that in mind. It's not always about medications, although a lot of people, the majority of the population, they will need a medication to help them stop smoking. Another thing that I have found with some of my patients is that a lot of them, it's the habit. So it's the action of getting that cigarette out, lighting it, and bringing it to their mouth. My mother-in-law, for example, she actually died from small cell carcinoma of the lung, which smokers are more prone to. It's a very aggressive lung cancer. Typically, people last about 3 to 4 months. She lasted about 3 months. She smoked about 3 packs a day, and she had been smoking like that since she was 15 or 16 years old. So you can imagine the damage that it had done to her body, and she continued to smoke like that until the day she died. So, one thing for her, she tried to quit so many different times, but one thing for her was not just that she really lacked good coping methods, but it was also just the habit of having something in her hand, that movement, and she associated it when she would go to the bar and drink. She had her cigarette in her right hand that she would smoke from, and So that's something that you have to look at with patients. So one of the things I have found that has worked with some of my younger patients is that a lot of the girls especially will wear a hair tie on their wrist. And so every time they want to have that movement with their hand, taking the cigarette back and forth to their mouth, they can kind of snap that rubber band a little bit. It's not going to necessarily hurt them, but it's an action that they can do in place of bringing that cigarette to their mouth. So just, you can be creative. You can talk with your patient about it, see what things will be able to fit into that habit rather than them going directly back to a cigarette. So just kind of keep that in mind. You may have to be a little creative. So looking at this slide, first line is the Chantix. I have some dosing there for you. All of these you're going to want to start prior to them completely quitting because they need to have it in their system. That way they're not going through these awful withdrawals. Bupropion is second to Chantix, and then the nicotine replacement, so that's the patches, the gums. I have found that a lot of my patients like the inhalers. Cost-wise, they're about the same as the patches. However, the patches do have over-the-counter. I know at our hospital, the supply that they use, it ends up being roughly about the same. So I tend to use the inhaler for a lot more of my patients than the patches. And again, for people that have that habit, it works out good because then they're still bringing something to their mouth. Some second line choices, like we talked about, is the behavioral therapy. And this is more so, or more than just counseling. It's actually a change in your behavior. So if you go through the whole psychology process of developing a habit and breaking a habit, that is what that is more geared towards rather than just counseling. The electronic e-cigs, a lot of times that works for people as well. The nortriptyline, I don't see as many people using this anymore because a lot of people are on so many medications. It's hard to add some of these medications because of interactions. So just keep that in mind when you are prescribing. So this, like I said, this is just a brief overview of tobacco cessation. So if you have questions, feel free to shoot me an email. Feel free also to use your phone app, the Nursing Central. There's a lot of really good information on tobacco cessation, a lot more than what I even included in here. So if you want to do some more research, then make sure you go and check out some of those apps within that app database. Okay, thanks guys.